Thank you for joining us, Dr. Kartzinel. We're so excited to have you on. Thank you so much for doing this and taking the time to speak with us and our audience, and also taking the time to answer some questions. So we'll just let you begin by introducing yourself and telling our audience a little bit about who you are and what you do, and how you incorporate the use of medical cannabis and CBD products into your practice.
Is this a cannabis CBD show? Oh, I prepared for something totally different. I'm so sorry. Oops, I don't use that stuff at all. Hey, yes, I'm Dr. Jerry Kartzinel. I'm a board certified pediatrician. I've been working in pediatrics now for over 30 years and specializing in neurodevelopmental problems in children. Obviously, autism is a huge part of my practice now for over 20 years. And it's been a challenge and a love and a hobby and a sport. It's everything for me. I got into this after doing just about 10 years of general pediatrics when my fourth boy developed autism shortly after his 1-year-old jab. And so we can keep this on without getting canceled. We're not going to be talking about anything in particular. So, the whole idea behind working with children with autism is that there is no such thing as, if you will, the autistic child. They all have symptoms that in some respects are similar to others and totally different with other children. It's kind of like if I had 4 children out in my front waiting room with a cough. You could diagnose cough and I could diagnose cough, but one of those kids is coughing because they got asthma, and one of those kids is coughing because they got a cold, and one is coughing because they got allergies, and one was playing with a toy part and they inhaled it. They're all coughing. Mm-hmm. And the diagnosis will be cough, but the underlying pathology is different. So here's the problem. If I give the child with asthma Dr. Jerry's magic asthma puffer, and mom uses it on the child and the cough goes away, she's going to go on the internet and say, wow, if you use Dr. Jerry's asthma puffer, it's going to make all kids with cough go away. Well, it'll help those kids with asthma, but it won't help the other 75% of them. It will help the 25% who have the asthma. The same thing with autism. There are so many different underlying problems that bring me to my clinic where you could say that child has autism. I could say that child has autism, but it's my job as a physician to figure out what kind of cough they have, what kind of autism they have. Yeah. And then we talk about the spectrum of diseases. And again, I look at autism as how they manage everyday stimuli. So the child who comes into my office and has a finger in one ear and biting his wrist and rocking and going doesn't understand when dad says I love you or mom says go get your shoes, sitting in a diaper still at age 8, all stimuli means nothing to him. Dad's saying something to him, his bladder or his rectum saying something like I gotta go pee or poop, food, he's not hungry, he's not thirsty. He's at this end of the spectrum. And then at the other end of the spectrum is the child with what we call attention deficit disorder. He has friends, he plays soccer, but when the teacher's talking about George Washington being the first president of the United States, that auditory stimuli goes in, he doesn't process it well. And so he's got ADD. And of course, when they ask on the test, who's the first president of the United States, he'll put down Joe Biden or something, who knows? So the whole thing is weird. So our kids have these scattered skill sets, and some things they do very well, and some kids they aren't, and that's where they're on the autism spectrum. Then my job is to try and figure it out, what it is that's causing them not to perform as well as they do. So I don't treat autism. I treat the underlying medical conditions. It's like saying I don't treat cough, but I'll treat asthma, or I'll treat the toy parts that are stuck in the lungs, or I'll treat the allergies. Yeah. And if the cough gets better, then that's a good thing. Now, you mentioned about cannabis. That is a tool in my tool chest. It is not the tool chest. And I want people to understand that it's not if I just did the CBN or the CBD or the CBG right, my child won't have autism. Right. Because a lot of these kids, for example, come in and they're severely constipated. And if I could see everybody, I'd say, How many of you have a child who's chronically constipated and has the diagnosis of autism? How many of you have children who are got chronic diarrhea or both? Well, you don't use CBD to treat constipation, but I can tell you this, if the child is severely backed up, it doesn't matter what I give them, CBD, CBG, or whatever, that child's still going to be up at night. That child's still going to be screaming. The child's still going to be miserable. I have to get rid of the constipation first to see some important work. Or what if they're allergic to gluten and dairy? And we keep the kids eating pizza and drinking soda, and they call up Myriam's Hope Hemp and say, what CBD do you have? Because he's anxious and he's irritable, and it's not going to work. You got to clean up this. So it's a tool in the tool chest. So that's kind of my general approach. Is that kind of what you were asking?
Yeah, and we're very, that's one of the things that in what we do with, not just with kids with autism, but with any kind of people that we deal with, any kind of medical issues, we always tell people it's not just cannabis isn't a one size fits all. It's not something that is going to cure everything or is even a cure. You need dietary changes, you need lifestyle changes. So I'm really glad that you said that, because there are people that feel that, oh, it's a magic potion and this is going to cure or get rid of my kid's autism. And it's like, no, there's so much more that goes into their well-being, and for this to work, like you said, it has to be more than just using cannabis or CBD. It has to be everything.
Exactly. So I do the whole child approach, and but getting back to it, once we get the child diet cleaned up, get their stools cleaned up, get rid of yeast, bacteria, mold, get the allergies under control, and the parent says, what have you got for ADD? What have you got for anxiety or whatever? Then we can come in and say, okay, let's put them on Prozac. No, that's the last thing you want to do. That whole idea of using these psychotropic drugs, I'll use them, but they're really, really rare. If you had a urinary tract infection, I wouldn't give you Prozac. It won't work. If you have an adrenaline issue, if you have a problem with your cannabinoid system, Prozac's not the answer, but that's the drug, or Risperdal, or Abilify, or clonazepam, one of the benzodiazepines. These are like candy to our psychiatrists, and they're just disastrous for our kid because they're not going to work because of the fact that they're not treating the right thing.
Yeah. Okay. That's really good information. Do you find, and I know this is a question that a lot of people ask us, do you find, or me particularly, do you find that like sometimes like nothing works for a particular child? Or do you find that if you do the diet cleanup and you implement supplements, including cannabis or CBD, do you find that there are some kids that it just doesn't work?
Well, if you're asking about just CBD, yeah, there are kids who can do any CBD or CBD with THC product, and it just doesn't work. In other words, it's not the right tool for their issue. Then I have to dig a little bit deeper. If you're asking the question, are there kids that nothing works? Very rare. But I do have some. They're kind of like trying to move the Titanic that's been in the sand for 100 years. It's like, oh my gosh, everything I do is just, and what it boils down to is this, guys. Look, if you come to me with a broken finger, I can get it straightened out. Maybe the orthopedic surgeon has to put pins in or whatever and cast it and it works pretty good. It's not as good as it should have been, but it works pretty good. But if you come to me and it's been amputated, I got nothing for that unless we go to the prosthetic department. But seriously, so when we talk about our kids when things aren't working, it's like, well, how much damage has the brain been exposed to? I mean, can we get hyperbaric oxygen to rejuvenate the brain? Can stem cells rejuvenate the brain? I mean, there's a lot of things that we can do. We may not get them back to full functioning like the finger, but we can get them to a point where they're sleeping, they're enjoyable to be with, we love having them with us, they're communicating with us, they're taking care of basic needs like bathroom and stuff like that. No, they're not going to go to medical school, or worse, become a politician, but they're able to function, and their bottom line is their quality of life and your quality of life with them is exceptional versus a disaster.
Right.
Okay.
Right.
So very rarely do I come across a kid that no matter what I do, is going to be helpful. And thank God that is most of the time. You come to me, and what I'll do is I'll break down the problems. Number one problem, how are we sleeping in a doc? He's got insomnia, he's up till 2 in the morning, or he goes to sleep at 10, he's up at 10:30, he goes to sleep at 12, then he wakes up, and then he's up till 4 in the morning. And man, someone's going to die in that household if I don't fix the sleep problem. Okay.
Yeah.
So I'm going to break it down to problems, and then I'm going to put them, what's top on your list, doc? And parents will say, oh, I want him talking. All right, talking or sleeping through the night, which do you want first?
Probably sleeping, I would imagine.
Yeah. So we break it down. And then as soon as we get rid of that problem, that one leaves the top, and 4 more come up, and then I work on those, and then those leave, and 4 more come up. So that's kind of how I look at it.
Yeah. Well, that's awesome to get like a little an insight on how you work with your patients. And I love that you use the whole everything approach, because I think that's really important. A lot of people have to understand that you can't just add in CBD or THC and expect it to be a miracle. It has to be a whole approach. So I think that's awesome. That's really, really great.
And you can think that way with just about anything you're needing to use CBD or THC for, whether it be, if you've had post-traumatic stress disorder from, wartime or military, or abuse as a child or abuse as an adult or whatever. It is more than just the CBD. I mean, even the vets, they'll do the CBD, THC, and they'll have their companion dog.
Yeah.
Or something else. There's always something else that you've got to, the therapies, the cognitive behavioral therapies, the EMDR therapies, they all work together like a burrito. And once you get that burrito in there, man, it's delicious. But any one ingredient isn't do it.
Right.
Put it all together.
Yeah. And I think that's really, like I said, I think that's really important for a lot of people to understand that it's not just one thing. It's a combination of a lot of different things, because autism is very complicated. And so you can't, it's not just here, give them one supplement and they're fine. That'd be great if it was like that, but unfortunately it's not. So no, thank you so much for giving us so much insight and input on what to expect, what a person should expect if they do come and consult with you for their child.
Or anyone else. It's not a recipe. It's not like, let's just, here are the 6 supplements you need, and here's the CBD you need, and have a nice day.
Yeah.
I wish it was like that.
Yeah.
But it's not.
Right. So Dr. Kartzinel, we emailed you. We had a lot of interest in questions.
Oh,
and
yeah.
I know that we emailed you quite a few questions that we received. And so our audience is really excited to, get your responses to some of their questions. So if you can please go ahead and start, maybe going through the list of the questions that we sent you, and maybe you can, give us your response.
Okay. So you have a new order, and I'll take them from there. Since the last time we tried this, I'm glad this is working. I'm so excited.
I know, trust me, we are too.
You guys are the new IT gurus.
Well, kind of, but it was pretty nerve-wracking, but we practiced a couple times.
Good job.
Yeah.
All right. So I've got the questions, and some of them are easy to answer, some of them are difficult. Like, for example, here's a little story, and this is probably very similar to some of the families who are watching right now. This is a 9-year-old who was diagnosed with autism and ADHD. And remember, autism comes with a bunch of stuff. Yeah, you get autism, but you get attention deficit, you can have anxiety, you can have obsessive compulsive behaviors, you can have oppositional defiant, tantrums, aggression. Okay, so this child's been diagnosed with autism and ADHD at 3 years old, and recently started the CBD treatments after removing propranolol, which is a medication for anxiety, and clonidine every night. In place, we started the CBD 25 milligrams twice a day, and CBN at nighttime. So CBN is really good for nighttime sleep for our kids. In a month now, we're up to 50 milligrams of CBD twice a day and 10 milligrams of CBN at night with a little bit of melatonin. And the child is on an SSRI called Zoloft, sertraline. His daytime CBD is taken with 30 milligrams of Vyvanse. So Vyvanse is an amphetamine for attention deficit and focus. So what is CBDA, and is it something I should be adding to his regimen? First of all, it's a great question, but I don't even know how he's doing on this regimen. Has his regimen helped? Is his regimen not helped? I don't know what his Vyvanse dose is or Zoloft, or I don't know what's getting involved with him not performing, obviously, where she's looking for something, but I don't know why. And I'm very target fixated. I'm a clinical doc. If you're target fixated on sleep, then I can help you. And is it working or not working? And once it's working, then we move off, and then you might say, okay, it's ADD. So, when I use CBDA, again, because this stuff's not cheap, and it does add up. And as we all know, insurance doesn't cover the cost of the cannabinoid products. What are we trying to achieve? So I couldn't even begin to answer that unless I knew a little bit more about what are we still having a problem with. If you're saying that we would like to try to get him off of Zoloft, what do we need to do? Or if we're trying to improve his focus and concentration, how can we do that? One of the other questions here, we've got this chronic inflammation going on, the PANDAS, PANS, Lyme's thing. So everything that I do has a reason. I don't just try something. So can't really help you on that question, but it is a good question to illustrate that when we make changes, we have to watch and say, here's what I'm trying to help. Is this particular product helping, yes or no?
Right.
Okay.
Okay.
All right. So we like your approach in helping pediatric patients. In your practice, you make dietary modifications. That's gluten-free, dairy-free, soy-free, and removing foods that are a problem for our kids. Supplements, because our kids are very picky. They don't eat vegetables, or they don't eat fruits, or they don't eat protein. They need supplements in the meantime. And prescription medication suggestions. Try and stay away from those, but sometimes I need them. How does cannabis fit in your approach with patients? Very good question. That's an A+ question. They used to say there's no such thing as a stupid question. Yes, there are. But this isn't one of them. Okay, so how does cannabis fit in my approach with patients? I'll use cannabis, and I guess this is a good segue into the endocannabinoid system. Okay, you guys heard of that endocannabinoid system? It's another system that they're still not teaching in medical school. One of my patient's older sisters just finished medical school, and she's going into anesthesiology. And I asked her, did they teach you, anesthesiology, they got to know all about pain control and inflammation. And I said, did they teach you about the endocannabinoid system? And this was last year. And she said, no, I had no idea we have another system.
Wow.
Back in 1987, I was working in a laboratory at St. Louis University where we were trying to elucidate whether we had cannabis receptor sites, cannabinoid receptor sites, because we didn't know if they were working at another receptor site or if we have our own. We didn't even know about the endocannabinoid system. And of course, it turned out we have cannabinoid receptor sites. So let me explain this using this as a drop off. And many of you probably already know this. I usually bring in the opiate receptor sites because everybody knows we have opiate receptor sites. And when we work out hard or run hard, we get something called runner's high. And our body releases opiates. We are opiate factories. We're opiate dens, and we release something called endorphins and enkephalins. Those are our opiates. And they give us that feeling of good job, that experience of just feeling good, and it blocks some pain. We can also get opiates from the pharmacy, and we can get opiates on the street too, okay? But we have opiate receptor sites, and they do things. It's kind of like a lock and key. You have a key to your front door lock. It only works in your door lock, and when you go in, it does something. Thyroid has thyroid receptor sites. Insulin has insulin receptor sites. Progesterone has progesterone receptor sites. Opiates have their opiate receptor sites, and they're on all the cells. And when the key goes in, the opiate goes in, it does something, and it blocks pain. We have cannabis receptor sites. So we're also little pot factories. Okay, and we have a different name for it. We don't call it pot or Maui Powie. It's analyte or 2-AG. And we make these, and I look at it as like God's dimmer switch. If you have too much anxiety, the cannabis system, the endocannabinoid system that we have is supposed to bring it down. Okay, so it just brings it down, or it can bring something up. It's trying to bring things into the middle. So if you have problems with hyperactivity, bring it down. Attention deficit disorder, bring up your attention and focus. So it's kind of a dimmer switch kind of a thing. And I always like to joke that my mama was born 2 drinks shy of being normal. Okay, she kind of come in grumpy, give her 1 glass of wine, give her another glass of wine, and she was a delightful lady for the rest of the evening.
Sounds like me.
Okay, see, so there are some people who are too, I was going to say 2 joints short of being normal, but we can't do that with our kids. But they don't make enough for whatever reason, cannabis-like products, and therefore they don't have that regulation. So we can actually help that, and we can give them these cannabinoids, hoping to bring anxiety down, hyperactivity down, focus and concentration up, bring down inflammation, all the things that many of your followers know already. Okay, so I don't want to be redundant there. So again, going there, I'll use cannabis, and depending on what we're trying to accomplish, like for example, I have a child on melatonin for sleep and we're not sleeping that great yet, I'll bring in some CBN. Okay, or I might bring in some CBDA, CBG for some reason that can help kids sleep on the spectrum. There's nothing in the literature about that, but that's just my personal experience saying, yeah, I think we're in the right ballpark, but we got the wrong ball. Let's try something a little bit different. One of the questions here was the frustration about dosing, a lot of questions about dosing, and B, how do you know which product to start? And all I can say is doctors who work with this is not just me. After they've been, like for example, here's my book. When I was starting, I would keep a book of all my patients, and I would keep a log of what I'm using. Like for example, Axel needed something for sleep, so I started him on CBN, but Aaron had tics and ADD, and I'll start him on CBD, and then it's either a go or no go, or I have to change the doses. So actually my kids taught me, they're the teachers, I'm the student, they taught me what works, and patterns start to exist. And then I learned, even as a guy, I can learn these patterns, and then I can exercise these patterns with the next child that I work with. So that's why I kept my book out whenever I start anything new, because another question is, what do we know about these studies? Are they doing studies on these kids? They don't even do studies on, anything with kids. Most of my information comes from the adult literature. So and I know parents hate this, but it really is trial and error. And then when you're working with the autism spectrum, well, everything's trial and error there. So there are no long-term studies for safety, except that we've been using cannabis in the human population as far back as I know, 7,000 years.
Right.
Okay, so safety studies seem to be pretty good. When it comes to working with our kids, guys, the safest thing always is to do nothing. That's the safest thing, to do nothing. And, I'll get comments from other doctors, using melatonin for sleep is not safe. I'll say, okay, you sit in this chair and you tell this parents what to give the kid. That's safe. And they rock back on their heel and all you hear is crickets. So now that we have to do something, because doing nothing is not an option for this family or this child, because we're going to go berserk if you don't, then let's pick the safest thing, cannabis, an herbal product. Come on now. All right.
Right.
So I'm really happy with that. So that's the answer to that one. The question that dovetails right into that, what cannabinoids have you found most helpful in your practice, acknowledging that everyone's endocannabinoid system is unique? I don't have one. I'm going to treat every patient as the only one I have in my practice. Okay. Yes, I've got an idea of where I may go based on lots of experience, but my experience means nothing to John, who just got here. He could care less about my experience. He'll give me the finger, this one, because we're G-rated, okay? That doesn't work for me. That makes me irritable and cry. That keeps me awake. You said it was going to put me to sleep. I'm going, but it put everybody else to sleep. Why is it keeping you awake?
Right.
So I have to be careful about generalizing this.
Yeah.
All right. Keep reading, or you have something you want to interject?
No. Go ahead.
Okay.
very helpful, even for us. Like, I mean, I feel like I'm learning so much. So,
And you do this for a living.
yeah, but I'm not a doctor like you. So,
Well, I just play one on TV. Okay, so what, here's another one. I love this question. What average dosing for cannabinoids have you found to be the most helpful? And I put in here the right dose. And the right dose depends on the child, but I always start low. Okay, so whatever product that I use, and again, it depends on the age too, right? So if you said to me, what is the right dose for a 2-year-old versus the right dose for a 22-year-old, they're going to be totally different, right? And so I have to use a very small dose. A smaller child, 3 and 4, I might start with 0.1 mLs, twice a day, just to see how things go. Just a little bit of these cannabinoids in their cannabinoid system, and it's like, let's see what this does. But I can make a dose adjustment every 3 to 4 days. And I have the parents email me, they tell me what they're doing and what behaviors we're looking at, and didn't do anything, doc. And I'll say, okay, go up to 0.2. On bigger kids, I might start at 0.25. For my teens, probably a little bit more. Okay, because I noticed, like, for example, your CBD oils come in 3 different strengths: daily 25, daily 50, daily 100.
right.
I'm not going to start on daily 100. I'll start at 25, and then I'll start with a small dose, work my way up to an ml, and then I might shift to the next one or the next one before I give up. So I don't have a right dose, because it also depends on what behavior I'm trying to modify. Am I trying to work with aggression, or am I trying to work with focus and concentration? Am I trying to work with sleep? Or how about anxiety? Or what if it's an adjunct to help me with chronic inflammation of the brain? All different things. So I'm going to use all different doses.
Yeah.
And I got all different ages and all different body weights. So can't help you there. I know it's frustrating though, but just keep working the dose until you find something that works. What contraindications have you found using cannabis in autistic patients? Those patients who are on many of the either psych drugs, or, which I'll use, but I'll use carefully, but the ones that are absolute no's are clobazam, which is a seizure medicine, valproic acid. And for you scientists out there, the CBDs inhibit a pathway called CYP3A4. And if you have another drug that also is supposed to be metabolized during that pathway, and you just inhibit it, you can make that drug toxic pretty quick. So we're just kind of careful there. How far has research come along on the long-term effects of cannabis in children? None that I know of. None that I know of. Short-term effects, yes, but long-term, I haven't seen that yet. And studies are very, very expensive to follow somebody. And again, what do you consider long-term? I mean, in the vaccine industry, long-term is 1 week. Okay.
True. Yeah.
Oops, not a good thing. But what if are you saying a 5-year or a 10-year? Who's going to do a study following 10 years of a patient who starts on cannabis at, say, 3, and at 13, we're going to do a study and follow them through that. So, and they're very expensive too, by the way. So it's going to be a lot of what we call anecdotal hearsay. And doctors who used to meet regularly about cannabis share their experiences too. Okay. What single area of improvement have you seen cannabis being most effective? Most effective is a good word, because it's not uniform. It's not always effective. I'd probably say anxiety and focus are kind of up there. And it always breaks my heart when they don't work, because I want them to work, because it's safe and you can stay on it, in my book, forever and not worry about it. It can't become dependent on it or whatever, but sometimes it doesn't work. Next question. Would you say CBD is a treatment for autism spectrum disorders, or maintenance treatment for the symptoms of autism? And like I said, it's part of the tool chest. It's just part of everything. You have to, they might be on magnesium citrate to keep their bowels rolling, and melatonin to help them sleep, and they're on a gluten-free and dairy-free diet, and they're taking vitamins, minerals, and omega oils, and they're using valerian root as well as, say, ashwagandha to help with anxiety. And it comes in as part of the team, more like a football team, as a one-on-one tennis team. Okay, so you gotta be kind of careful there. So I can't say that it's and remember, I'm never treating autism.
Right.
That's the thing. I'm always treating the anxiety component, or the OCD component, or the sleeplessness component, the inflammatory component, but I'm not treating autism. Yeah, when I treat those parts successfully, does the autistic behaviors diminish? Yeah, definitely. There are some people out there who say, stop treating autism as it's a disease, and they want to have a conversation about me. Well, most of us with kids on autism, with autism, would love to have that conversation with our kids because that's not where they're functioning. But with that said, is I'm not treating autism. Say you broke your arm. Would you not want me to treat you because you have autism? No, you'd want me to put the arm in a cast and let it go, irrespective of your autism. When I'm treating people on the autism spectrum, I'm treating their anxiety because nobody deserves to have anxiety just because they have autism or constipation. Why would you allow a child, well, he's got autism, so he's willfully withholding a stool because it's the only area of his body he has control over? What child on God's green earth willfully withholds their stool? No, he can't have a bowel movement to save his life and it's killing him inside. Fix that. That's how I look at it. All right. Are there any side effects to be concerned with in my 9-year-old son? Why are they always 9? Who has autism and ADHD, especially since we seem to be titrating up the dose to help him focus and control aggressive outbursts. So what symptoms do I see that are not good when we bring in cannabis? Irritability is big. Emotional. They just start having this emotional ability. They're crying, or they're angry, or they're mad, or whatever. Or the opposite reaction. They've taken the cannabis and now they're up all night. Okay. Now, how does that happen? Well, welcome to my world. That's what happens with our kids. Or it doesn't work. No matter what we do, it doesn't work. And we either have the wrong cannabis product. And that's why I like Myriam's hope, because if it doesn't work for them, I don't ever have to worry about it not being a good batch or a good quality that they got at the 7-Eleven or something like that. When people say, oh, I tried stuff at the store, the grocery store, at the CBD shop, and it didn't work, then I'm always concerned, well, maybe that wasn't a great distillate, a great product that they had. I never have to worry about that with Myriam's.
Thank you. We appreciate
And
that.
she didn't pay me to say that, guy.
No, we didn't.
Should have asked, right? That'll cost you 25 bucks. Okay, so
I'll sell you.
how much is too much? As I know one kid with autism, you have one kid with autism, I'm afraid to continue to increase the dose since it's not like a normal pharmaceutical based on weight and age. You're absolutely right. And what I tend to do is, as I increase the dose, I'm in the same ballpark as you are. There are no published doses because there's no steady state child. I mean, at least, if a child comes in with an ear infection, the dose of amoxicillin is 1 teaspoon 3 times a day for 10 days, nice and published. It's easy for me to do. For this, what I tend to do though, is I titrate the dose. That means I'm adjusting the dose up, and every time I make a dose adjustment and the child gets better, that's kind of encouragement for me to do it again. Once we hit the plateau that I increase the dose, nothing changes, increase the dose, nothing changes, then we've hit the max dose. My daughter benefits from CBD for anxiety. However, since she entered adolescence, dun, dun, dun. That's why I didn't have girls. I have 4 boys. Okay. Girls hitting adolescence, didn't want that. She's having great difficulty with her thoughts. Okay. Right there, this could be hormonal. And you can't blame everything on cannabis. Okay. And a lot of these girls in my practice seem to need more progesterone. A topical cream or an oral to help them days 14 through 21, 14 through 24. They don't have enough progesterone and they go crazy without it. Difficulty with their thoughts being front stage nearly all of her waking hours. Would you please talk about CBD, CBDA? My thought would be, first of all, I would probably do a hormonal profile and track her menstrual cycles with her moods and her thoughts and see if there's a trigger there. The week before her menstrual flow, her thoughts are all over the place, or her thoughts are too intense or whatever. That'd be a clue that this is not, CBD does not really manage hormones. Okay. Right. So in our kids, they have all kinds of problems. They got problems with the thyroid hormone, or they can have a problem with growth hormone, or they can have a problem with adrenaline, or they can have a problem with their estrogen, progesterone, testosterone balance. And it has to be a beautiful ballet for them to feel good. And if any one of those is out, it's like hearing somebody hitting the wrong chord on a piano, you know right away, that's not good. Even though you may not be a musician, you could tell. So I'd be all over that first, because your biggest clue is since she entered adolescence, and the acne and the facial hair and the cycling, I'd start there first before I asked CBD to do something. Okay, now with that said, the other things are diet, exercise, her weight. Some of these gals that I see, they're 200 pounds, and fat is inflammatory, and it acts as its own endocrine organ. It's making hormones. They're eating carbs, they're eating sugar. Those are going to have more of an impact on their behaviors than giving a little more CBD or CBD with THC. Okay. So you gotta be careful with that one. So that one's a little more difficult to answer. Oh, here's not a 9-year-old, it's an 8-year-old. A year ago, my 8-year-old son was diagnosed with PANS, which is pediatric autoimmune, neuropsychiatric, crazy stuff, OCD, anxiety, disorder associated with, if in this case, maybe strep, but you can have other things that can trigger that, Lyme, Bartonella, etc. etc. So I wonder about that diagnosis. Okay. At 15 months, he was diagnosed with the first spectrum disorder. We now believe the spectrum disorder is actually caused, well, they don't cause Lyme, but whatever. He takes Myriam's hemp daily, 100 CBD. Okay, the daily hope. All right, so the daily 100. Can you speak about inflammation in the brain? Can CBD help remove that? No. CBD will attenuate inflammation, but it doesn't remove it. It just brings it down. Now that's where the medicine part comes into it. We have to do something to ameliorate the syndrome, the inflammatory syndrome that's going on. And the whole inflammatory system might actually be a mold problem that's creating a chronic inflammatory response syndrome, CIRS, and that's leading to all these other little problems. So that is a very juicy problem, too big for CBD. But CBD can help manage it, but there's other things that have to be done. All right, so what can help my son, 13-year-olds with OCD, ADHD, and anxiety as spectrum signs? That in itself is probably a 4-hour talk. So we're going to pass over that. I mean, if you just said, what helps my son with obsessive compulsive behaviors, could be a long talk. Okay, because that could be streptococcus, or that can be a serotonin transport problem, a genetic problem. We have to give 5-HTP, hydroxytryptophan, so it can be converted to serotonin. I mean, there's a lot there. Can't go there. Let's see here. Do what we currently know about cannabis and autism implicate a strong effect in improving the comorbidity of autism and not the disorder itself? Yes, I mean, that's kind of what we've been saying, that autism is the final common pathway, like a cough. And if you take care of some of the other problems before it, then the autistic behaviors get better. So, but irrespective, like I said, irrespective of what you want to call autism, if you're autistic and you have anxiety, then I'll let you be autistic, but without anxiety. If you have autism with constipation, fine. But why should anybody have constipation in 2021? We know how to take care of that.
Yeah.
If you have chronic reflux disease, why would I say, well, that's just part of autism. Lots of kids with autism have reflux, go home and have a nice day. That's phooey talk. Come on now. So yes. Now, my finding is that wherever you are on the autism scale, the CAR scale, if I take care of some of those things, it goes down. In other words, you become more and more like your peer group. Are there specific formulas for CBD out there that are better for those with tick-borne diseases? That's a complicated question. Remember, the CBD is going to help with inflammation, and there's lots of different types of tick-borne diseases, and doctors who are just Lyme literate and that's all they do is treat ticks, they don't even agree on approaches. So there's that. Now, I tend to work a little differently in my office because many of the treatments for PANS, pandas, and tick-borne diseases is tons and tons and tons of antibiotics. and I tend not to use that. I try to use like helmet therapy. I'll use parasite therapy or something like that to help the immune system stop being so darn inflammatory and autoimmune.
Yeah. Dr. Kartzinel, before we end, there's one question.
Before we end,
I know we have a bunch of questions. There's actually one question that I wanted to bring up because it's something that we get asked a lot. As far as terpenes, can we talk about terpenes? I know that when we get a lot of your patients, a lot of them that come through, you recommend like different terpene blends.
right.
I guess my first question is, do you find that have you been seeing a big difference with patients when they're using CBD by itself, or not by itself, but like without the additional terpenes? And then do you see a really big difference once they come back after they've added in the additional terpenes?
All right, so we have to understand that terpenes are natural components of the plants. When you walk through a pine forest and you smell that pine smell, that's a terpene, okay? Or for families who haven't gone through pine forest, pine sol. Okay, so these are, if you will, essential oils, are part of aromatherapy, but they really do have a powerful effect in people as far as modulating mood and modulating focus and concentration. When in the process of making CBD oil, the distillation takes out all the terpenes. So they can show the government, this is CBD, there is no THC in here, or very little underneath the legal amount. It's just pure, and that works, that's CBD oil. But there was terpenes in there, and those terpenes, I think, can be very helpful in adding to the effects of the CBD, adding to. And the terpenes that I tend to use are myrcene, as you know, and pinene, and limonene, linalool, and the beta-caryophyllene. Okay, so when we use these, and the folks at Myriam's is kind enough to open up the bottle and put some more of that stuff in there for my families, it works. Now, there's a silly word that everybody's into these days, is the entourage effect. It all works together, kind of like the burrito effect is what I use, but entourage sounds kind of cool. It just seems that when I've been working with the kids, I want to stack the deck in my favor. Anything that can help this kid's focus or concentration be better, even if it's that much more. Here's what CBD can do, but if I add the terpenes, I get bump. And I wish it was like that, but it's an additive, and it's a much better effect than the CBD. I don't even, if I'm treating focus and concentration, that ADHD, as you know, I ask for terpenes for everyone. At worst, it doesn't do any more, but it didn't cost the parents anymore. Right. And at best, it's really amplifying what we're doing. So I tend to use those.
Okay. Awesome. Yeah, because we do get a lot of questions about them sometimes. Obviously, not everybody can go to you, consult with you. So we get a lot of those questions, and we try to guide people as best as we can. Sometimes there are families that we have to help on our own because they can't afford a consultation with a doctor or a nurse or whatever the case is. So it's always kind of good for us to have that knowledge as to kind of like behind, like why the idea of like why you're adding the certain terpenes to, like the ADHD terpenes, the OCD terpenes. So I've learned a lot from just working with a lot of the patients that you send us.
Mm-hmm. Yeah, because they give you nice feedback. It's working. Right.
Exactly.
And as you see with my patients too, they don't just try it and then they're done. They keep coming back. And the only reason they keep coming back and spending money is because it's working.
Right.
Or they wouldn't be doing that. Right.
Awesome. Thank you so much for answering those questions. I know we're pretty much almost done with our time, but we really wanted to say thank you so much for coming on here with us. We know you're like super busy, but this was really helpful, and we really appreciate it. So thank you so much, Dr. Kartzinel.
You're very welcome. It's been a pleasure and honor to be here. And if we want to do this again sometime, just let us know.
Yes, we will definitely set something up again with you So this was very helpful. And I'm sure we're going to get a lot of really good responses from everybody. Because the last time we tried to do this, as soon as we couldn't go live, we started getting a bunch of emails and people messaging us on the chat, like, what's going on? And we're like, oh, sorry, we had technical difficulties. So we know that a lot of people were really excited to hear you speak and answer some of these questions for them.
Perfect,
Thank you
perfect.
again.
And if they want to reach out to us, you can just email us at frontdesk@drjerryk.com. You can go to the website, drjerryk.com, just if you want to read a little bit more about what we do here. And be always willing to help families out there. So thank you for all that you do as well.
Thank you. Have a
All
good
right.
day, Dr. Kartzinel.
Thank you. Bye now.
Bye-bye.